Glad to have you back. It's still the morning show here on Arise News. And integrative medicine is healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient. It's informed by evidence and makes use of all appropriate therapies. Meanwhile, the World Health Organization, WHO, traditional medicine strategy was developed and launched in response to the World Health Assembly resolution on traditional medicine. The strategy aims to support member states in developing proactive policies and implementing action plans that will strengthen the role traditional medicine plays in keeping populations healthy. Well, joining us to discuss on how integrative medicine can provide a work balance and lead to a healthier nation is Executive Director, Quincy Wellness and Naturopathic Center, Tobi Ayodele Keeney. Tobi, glad to have you on the morning show.
Nice having me. Thank you.
All right, good. What is the correlation, let's start that way, between integrated medicine and work balance? And when we say work balance here, what exactly are we talking about?
Okay, so first thing, I'll just talk about how our current healthcare system is not, helping to create a good work-life balance. So first of all, about 90% of Nigerians lose at least 9 days of productivity per year just visiting the hospital alone. I'm not even talking about the time they use, to recover from the illness or, hospitalizations or admissions. But just going to the clinic, they lose about 7 to 9 days. So you can imagine over the course of a year with sickness and illness and things like that, they are losing, days, weeks, even possibly months from illness, especially chronic illness. So integrative medicine really is a combination of using medicinal plants as well as the Western approach in getting that person to have an optimal state of health. So it's not just, treating symptoms or treating illnesses, but actually getting that person back to as healthy of a state as that person can be. And when you are generally healthy, a healthier nation actually leads to a richer nation. In the US, for example, 30% of people employ traditional medicine as part of their daily or their regular healthcare use. Meanwhile, in Nigeria, 90% of the people do that, but not on a professional or an official basis. And that's where the problem is. We need to be healthy so we can be more productive in the nation. And if we're more productive, we're richer. It's a win-win situation.
Right, Tobi. In the fight against COVID-19, there have been different myths on the use of traditional medicine. Some people have recommended like the neem leaf to help alleviate, the symptoms that come with COVID-19. I'd love your comment on this use.
Okay, so, when COVID-19 came, this is something nobody ever, nobody envisioned or envisaged, let's put it that way. And unfortunately, Western medicine failed us in the treatment of COVID-19. However, yes, there are lots of traditional medicinal plants that have been proven with evidence-based research to suppress coughs, to reduce mucus in the lungs, to boost immunity, to antibacterial, antiviral, and all sorts of different properties. And the Ministry of Health actually called us traditional medicine practitioners to come up with a treatment or a remedy for COVID-19, which I think a lot of us have done. However, with Nigerian bureaucracy, it takes a while for things to be passed into law. However, yes, do you know one thing I did notice? I can almost say we don't have COVID in Nigeria anymore. Not that we do not actually have COVID, but Nigerians actually have been able to beat that COVID because they started using the neem plant, the dongoyaro, garlic, ginger, honey. things that we just take for granted. They're actually proven to suppress viral activity, to help with antibacterial. They have antibacterial qualities, and boost immunity and boost health in general. So we actually are having stronger immunity against COVID-19 here than in other countries where they don't, see it as a big deal. I would applaud Nigerians that are in Nigeria for doing that. And how we were able to notice that it's not necessarily because you're a black person. That's why you are less susceptible. Black people in the U.S., Nigerians in the U.S. actually are having even more problems with COVID-19. But here, we're actually a healthier nation in general. We do believe in traditional herbs, and we're using it, and it's actually working for us with fighting COVID.
All right, interesting. Let's talk about the word, is it 6-letter, 5-letter word, stress? Stress. Mm-hmm. I just read, I haven't seen it in this dimension before. I just read that stress can be positive, enhancing performance, or negative, doing the exact opposite. Break this down a little bit more, and what are these natural ways of handling and cooling these feelings of stress? 2 questions.
Okay, so stress is a natural response to a trigger that is difficult for you to handle. And as a Nigerian living in Nigeria, I can tell you for sure that we are very, very stressed.
I was, Tobi, the other day I spent 5 hours going back home and my AC wasn't working. I practically cried in my car. I was sweating like a he-goat. It was horrible.
Cry.
It was.
Yeah, it is Nigeria is a stress. Lagos especially is a very stressful place. Then let's not even talk about the recent happenings, with civil unrest, with the COVID-19, loss of property. I mean, if somebody says they are not stressed right now, then maybe the person is living in a bubble or a cage or something, because stress is real. However, stress is necessary. A little bit of it is necessary so that you can be active and, try and get out of the situation. But when you are constantly stressed, constantly, exposed to things that make you become stressed, it can actually be detrimental to your health. It raises your level of cortisol in the body, and just being stressed constantly can cause heart problems, can cause high blood pressure, can even cause mental problems that that mental problem that we're not even in, it doesn't run in your family, doesn't do anything. It can cause anxiety, depression, it can cause all sorts of things. So how do we handle stress in Nigeria? How do we handle stress naturally? First of all, if I say people should try and just reduce or avoid the stressful situation, I'm deceiving myself. The stressful situation is not going anywhere. However, we have herbs, medicinal herbs, that can help balance your mood out. We have, therapies that can actually help to relieve stress, even targeted therapeutic massages, physical therapy, psychological counseling.
Can you be more specific?
Okay, let me give you actual herbs. Okay, there's this great one that we use for anxiety. We use magnesium. People don't even think about magnesium as anything special. But magnesium actually relaxes skeletal and smooth muscle. And by doing so, when you are stressed, you're actually tense, and you don't know that you're tense. You're just naturally tense. Before you know it, you're having backache, neck ache, and all kinds of different things. Magnesium is actually very good for relaxing the body in general. Then ashwagandha is very good for actually balancing out your mood. So we have some people that have a natural propensity to developing anxiety or depression or even mania, paranoia, for obvious reasons. That's a herb that can actually help to balance that.
Fantastic. I have learned something today. Ashwagandha. I mean, that definitely is one product that I would love to
like
try.
A Tanzanian or Zimbabwean name.
It sounds like a Tanzanian or Zimbabwean
chamomile,
name.
there's valerian, there's chamomile, There are so many different things. But I won't tell people, oh, just go and buy ashwagandha and start drinking. It is better to,
All right.
have it on a prescription.
We will get back to you, Tobi. Still hanging there. You're still watching The Money Show. All right, glad to have you back. You're still watching The Money Show. And we still have Tobi Ayodele Keeney, Managing Director, Quincy Harbors. Dear Tobi, good to know that you're still there. Now, let's take this a little bit further and deeper. How can employers of labor, help its staff to reduce or, if you like, totally eradicate stress, which in turn, you said that, you've alluded to that, increases productivity. Do they even know this can be the case?
You're asking does the average worker know that, stress or, anything do they know anything about preventative health? Is that what you're asking?
No. I said, how can employers of labor help its staff?
Oh, great.
Reduce or totally eradicate stress, which in turn, of course, like you've said, increases productivity. Do they even know that this is the case?
I do not think a lot of people think about stress and how it affects the productivity of the workers. Definitely, I would advise employers of labor to have a conducive working environment for their staff. That's number one. Number two, also make sure that their hours are such that they can such that they can get home on time, or at least, even if they're working long shifts, they can have some days off so that they can recover. Then the third thing I would suggest to employers is have your staff go on preventative health checks. Blood pressure checks, diabetes checks, liver function tests, things like that. Things that we just let that person know, okay, I'm having this thing going on, and quickly address it before it becomes a problem, and then the worker is even out of work because he or she is sick. So those three things is what I'll suggest for employers. A lot of them don't even know. They don't even take care of themselves, talk less of taking care of their staff. But if you have a healthy staff, if you have a happy staff, then you're going to have better productivity, more money, more income. It's a win-win situation, like I'll say again.
Yeah, you have given some great advice on the use of a traditional medicine. Now, I'd love for you to tell Nigerians what they can do proactively to manage their health, to achieve a vibrant, health-enhanced energy and creativity. And also, for the government, what proactive policies can the Nigerian government adopt to help, keep our population healthy?
Okay, so that's a very good question. There is a traditional medicine bill that has been waiting to be passed for about 20 years that would enable integration of traditional medicine into the existing healthcare. And the reason for that bill is to, by the WHO, they know that doing that will actually improve the health of the average Nigerian. The second thing is we need to have a better focus on preventative and public health. There's no public health awareness about a lot of things. The last time I heard anything about public awareness before COVID was when I was a child, and they were talking about ORT and all these different things. There's no public awareness campaigns going on. Then the third thing is, first, we need to look into medicinal herbs as another source of income for the country. We're relying on oil, relying on oil. Other countries like China, they are actually making use of traditional herbs and is making a huge income for the country. We have a large biodiversity of herbs in Nigeria. Imagine if we actually tapped into it and started to process it and started to export it. We may over time not rely on oil anymore and rely on our actual ground and our soil to make money for us. Like I said, if the nation is healthier, if there's more focus on preventative health, more focus on making sure they are getting tested. Even if the government can do something like have an insurance plan that is free or subsidized, where people of lower income can come to, get their labs done, get a checkup, just to make sure they're fine. And early detection is key for things like diabetes, high cholesterol, high blood pressure that we're experiencing today. We should reduce our mortality rate of 55, 53 years. We need to increase it to 75, 80, or 90 years. 55 years mortality rate is too low for Nigeria, and we need to increase it. Very, very important. The government needs to actually work on that.
Watching you, the passion with which you're discussing this, the love you have for it is quite captivating, really interesting. One wonders, how did you get into all this? I'm going to ask you another question. This is a little bit longer, but how did you get into all this? Then the second question is, there seems to be a real conflict between the, if you like, you call it comparative medicine or complementary and alternative medicine, integrative medicine or integrated medicine or integrative medicine, and medical science. There seems to be a conflict here because they are based on theories that contradict the science of the human body, how the human body works. So what's been the impact of this conflict or contradiction on your practice, and how are you working around it, Tobi?
Okay, so just to hear you clearly, you're saying that there's a disconnect. There's
conflict between what you do and medicine and medical science. Yeah.
Okay, so actually what we do at our establishment is we actually only practice evidence-based medicine based on evidence-based research. There's this, unfortunately, herbal medicine as we know it has been bastardized by a lot of quacks and a lot of different people. We at our center, we practice evidence-based medicine, even though we're using traditional herbs as well. There are a lot of research and journal articles and information about medicinal herbs. Lagos State, for one, has done a very good job in establishing traditional medicine in Lagos. We even have a pharmacopoeia of African medicinal herbs and their uses. There still needs to be a lot of work done in terms of standardizing the doses and all those different things. But we have actually standardized our doses, and we do not just give people anything without proper medical consultation. So that's the difference between integrative medicine and just the regular Nigerian medicine, herbal medicine you see here. You come to our clinic, you have a patient intake form, we check everything about you, ask you about your medical, surgical, mental, all your different histories. And then we actually have a laboratory to perform standard tests, whatever test that person needs. And then based on that test, we can now decide, okay, this is what you need. If it's an acute case, you need, of course, Western medicine. If you need to be on IV drips or you need to be on antibiotics or whatever it is. But for chronic illnesses, Western medicine has actually failed us. They do not have the solution for liver disease or to cure diabetes, for instance, or get the person out of the state of diabetes. But in traditional medicine, they actually have that. But we have standardized our practice. So we practice traditional medicine in a very standard and scientific approach. So the contradiction is not there in our own case. However, I do understand what you are saying, where people think, and then the other thing is we need to make that demarcation between traditional, spiritual, like Babalawo type medicine and actual medicinal herbs, and practitioners that use medicinal herbs at a standardized dose, have client cases, have progress notes, do everything like you would see in a regular clinic, but we are also using traditional medicine for certain cases.
All right, Tobi, I wanted to ask you a question. You just talked about chronic illness and the cure for liver disease. For the benefit of our viewers, I'd love for you to elaborate on that. And I'd also like to know if you are certified.
Yes, so we are certified under the Lagos State Traditional Medicine Board. And also, we are on our way to getting certified under HEFERMA. So we're going to have 2 certifications, both the Western medicine certification and the traditional medicine certification, all, certified. We even have products that are NAFDAC. We're actually very well certified. Now, for chronic illnesses, people do not know that chronic illness is a very big problem in Nigeria, especially in the urban centers. We have higher cases of diabetes, higher cases of high cholesterol. If you notice, a lot of people, you just hear, oh, when they turn 50-something, they just drop dead. And that was the end of it. They just dropped dead, or they slumped, or they had a stroke. It is usually because of an underlying high cholesterol, hypertension, whatever it is. Even for diabetes, you're just hearing, oh, they just fell blind all of a sudden. If we can actually address the situation before it gets to the point where the person dropped dead or the person got blind, then can you imagine how many more years of productivity that person has? So we actually deal more with I'll say that is that's our core competency. Chronic illnesses, liver disease, cancer, things like that. We deal with it. At Quincy, we're actually known as a last resort place. So people usually we go all over the place looking for a solution to their problems, and they don't find it. And then they come over to us, and we are results-oriented, not money-driven. We're actually results-oriented. We want you to be healthy. We do not want you to come back sick. We want you to be healthy. We want you to have an idea of, oh, this is what I should eat. This is what I should avoid. This is the types of things I should be taking. We want you to be actually healthy and be fully discharged, and just come back for checkups and follow-ups, every year or twice a year, whatever it is, after you're done with your treatment. Especially obesity is actually a growing problem in Nigeria. Surprisingly, we're having, especially in urban centers, because of the westernization of our foods. And obesity actually leads to diabetes, it leads to hypertension, it leads to arthritis, it leads to inflammatory diseases, it leads to everything. So by treating the obesity, even leads to infertility in both men and women. So by treating the obesity, we actually are treating a lot of other problems. And we don't do, we just take this help and go. It's a multidisciplinary approach using different types of therapies, including Western medicine when needed, to achieve a positive patient outcome.
All right, Tobi, I don't remember that you answered my question really about how you got into all this. So let me ask you again. Your background, how you got into it. You don't look like the normal one that practices integrative medicine there out there. So maybe I should use the word more polished, no harm meant. But so, what's your background? How did you get into this?
I don't look like an Onishegun. That's what you're trying to say.
I don't know what that means. But
Yes, like a herbalist.
Okay, well.
So my mother, actually, I would say Dr. Mrs. Quincy Ayodele, she was the pioneer of traditional medicine, treated, practiced in a modern way. And she started this business about 24 years ago, and had to do a lot of awareness just to get people out of this whole, idea that herbal medicine is fetish or spiritual. She's actually a World Health Organization expert on traditional medicine, and I've co-authored a lot of her articles and presentations that have actually been put into place. And that's why she's one of the people that have brought traditional medicine to the forefront, even in the World Health Organization. So I have a master's in nursing, and I also have my diplomas in naturopathic medicine as well. I'm also a certified nutritionist, and I personally have a passion for traditional herbs. What made me to actually get into it, what really made me to get into it was actually my personal struggles with chronic disease. I had some complications after having my children via C-section, and the Western medicine failed me. There was nothing they could offer me. So I had to actually go back into, the herbs and the medicine, the traditional medicine and the diet. And I became functional again. Wow. So not just that I read it, not that I practice with it, but I also experienced it. So that is what is giving me more of a passion than I'll say, oh, I'm just doing it as a profession.
Quite interesting, experiential. And that's the best kind of way to go with these things. All right, let me just
We're good.
Okay, let me ask you this. Will it be correct, Tobi, to say that what is considered integrative medicine changes constantly as treatments are studied and move into everyday practice?
Definitely, integrative medicine is medicine in general, whether naturopathic or integrative or allopathic, osteopathic, chiropractic, whatever it is dynamic because everybody is different. You are not going to, you can, yes, we have some guidelines, to follow for certain conditions and things like that, but everybody is different. And the world is actually moving towards integrative medicine because the truth is that two heads are better than one. If you can combine Western approaches with medicinal herbs that are very potent, we have a lot of potent herbs.
Why not?
Pardon?
Why not?
Exactly. Why not? Yes. And the aim is, let's reduce your reliance on medication and let's improve your reliance on eating. It says, let thy food be thy medicine.
Yeah, I love that phrase.
So
I remember somebody saying that medicine is actually poison. If you don't take it well, it's actually poison.
Yes, yes. And medicine is also an art, more than just a science.
Well, thank you very much, Tobi, for joining us on the program,
thank you for having me
today. Well, it's time now for a short break on the morning show. When we return, we'll review top stories on today's newspapers. Do stay with us.